Marion, this is Dr. Shannon Wong. I'm going to narrate your right eye surgery that was done on Monday, February 4th. First step is we're going to use the Lens X femtosecond laser to prepare the eye for the remainder of surgery. Here we are aligning the laser on your right eye. The purple circle is the diameter of the opening that we're going to place on the sac that surrounds your lens. The yellow circles are the pattern that the laser is going to use to break up the lens, and the two white arcs at 1 o'clock and 7 o'clock are the astigmatic incisions. We call them the astigmatic relaxing incisions. So now we've centered the treatment on your eye. We create a three-dimensional image of your lens inside the eye and a three-dimensional image of your cornea. This is the top right window is the front layer that surrounds the front of your eye. This bottom right image is the lens itself. The yellow pattern is where I'm going to laser the inside of your lens with the femtosecond laser, or what we call the Lens X laser. I'm telling it to sculpt a pattern within your lens to kind of break it up, essentially to pre-crack it. Then I'm going to take an image of your cornea. The top right and top lower right images were images of your cornea where we're going to incise it. Here, the left image, we're using the laser to create a circular opening in the what we call the anterior capsule of your lens. On the lower right image, you see a progress bar of a purple bar that's rising toward the top. It just shows the progress. Here on the left side image, we're lasering the lens inside the eye, breaking it up, creating a little circular disc, and then we're incising the cornea now at the lower and upper side. We've then taken you to the operating room, and the eye has essentially been prepared, and now we're getting a view of the eye under a different operating room microscope. In your case, we elected to use a few manual incisions. This first manual incision is like an access port for us to infuse medicine into your eye. So we infuse this thick, clear gel called viscoelastic. It creates space in the eye, and it stays in the eye longer than the normal watery fluid. So it allows us to work inside the eye without the eye itself kind of collapsing. Now there's an outer clear layer to the eye called the conjunctiva, and I've got to remove that conjunctiva, which I'll do in just a moment. Here I'm filling the eye with more viscoelastic. I must have felt like your eye did not have enough in it and the eye was still too soft. So I put in more, and it pressurizes the eye. And this clear gel also kind of protects the inner layer of your cornea. The front window of your eye is the cornea. The inner layer of your cornea is subject to swelling and inflammation from all the instruments that we put in the eye, and that clear viscoelastic protects the inner layer of your cornea during surgery. So here I'm incising the conjunctiva, or the outer clear coat of your eye. It surrounds the white shell of your eye called the sclera. In your particular case, it was more appropriate for us to make this entry with a manual incision. This is it's a man-made diamond. It's called a black diamond. And we make a 2.8 millimeter opening into your eye, and we line it up with the astigmatic incision that was created by the Lens X laser, and I'll show you that in a minute. Then I use another instrument to go in and essentially separate out what the Lens X laser had done before, which is cut out that circular opening to the anterior capsule. This instrument is now kind of separating that circular button that was lasered. And that worked out perfectly. And then we'll take some saline. Actually, that's more viscoelastic. We put it on the eye to kind of keep the surface of your eye moist, surface of your cornea moist. Then we take this saline solution and infuse it between your cataract and the capsule or clear sac surrounding your cataract. Then we take what we call a phacoemulsification handpiece. It's a little handpiece that infuses fluid out. It vacuums fluid into a port, and it vibrates using ultrasound energy. So it does three things. It infuses fluid, so when we're working in the eye, it keeps the eye filled. Otherwise, the eye would kind of collapse because we'd be vacuuming fluid out and we wouldn't be replacing it. This is infusing fluid and vacuuming fluid out at the same time, and it has a little vibrating portion of itself that when we turn it on, it vibrates and breaks up the lens into essentially lens dust, and it vacuums it out here. It's using ultrasound. It's vibrating very fast, and we can kind of essentially pulverize the lens and vacuum it up. And I use the second instrument on the left side to kind of provide some counter traction, and we crack the lens. Your lens is about 15 millimeters in diameter, and we're taking it out through a 2.8 millimeter incision. The way we do that is we break it into little pieces that are more manageable. And we're breaking it, in this case, into 4 quadrants, and each quadrant is probably about 4 millimeters in length. Once we've created the 4 quadrants and cracked the lens, then we use the phacoemulsification handpiece to grab each quadrant, pull it up, and then we activate the ultrasound, also known as phacoemulsification energy, spelled PHACO, emulsification energy, and it just vacuumed out that one quadrant. And then we move the adjacent quadrants in front of that phacoemulsification handpiece. It grabs onto each piece, vacuums, emulsifies, and we're able to remove now the second of 4 quadrants. And we just repeat the process for each of those 4 quadrants. You've been given just an eye drop anesthetic. Topically, there's no IV sedation. We've given you a little Valium to help you stay calm during surgery. That's the third quadrant, and then the final quadrant. Now, these quadrants are fairly, show that the lens is fairly dense. Not dense like, a gem or glass, but it's dense like, kind of like wax. Now, that phase represents removal of the inner, let's say 90% of your lens, which is fairly dense. And then we're going to proceed with removal of the outer soft shell of the lens, which probably represents about 10% of the mass of the lens. And we use a slightly different instrument. It's called an irrigation and aspiration handpiece. Here I'm just removing some of the viscoelastic that we put in, and then I sneak this. This device only infuses and it vacuums. It does not vibrate. No ultrasound is used here. And we're grasping the outer shell of the lens and gently teasing it away from what we call the lens capsule, which surrounds your cataract. So this lens capsule held your lens all your life. We made a circular opening in that lens capsule with the LensX laser. We teased away that front circular opening, vacuumed it out, went in with our phacoemulsification handpiece, vacuumed out your hard core of your cataract, and we're using this irrigation and aspiration handpiece to remove the outer soft shell of your cataract, but the capsule is still intact. but now it has no lens in it. As you can see, the capsule is pretty clear. That orange reflection is in the back is the reflection of your retina, which is the inner layer of your eye, the inner nerve tissue layer of your eye. When people have like an orange or red eye with a photograph, it's because the camera's picked up on the reflection of the retina, which you can see is kind of burnt orange in this case. So now the capsule's been preserved, and the cataract has been removed in its entirety. The only remaining bits of the cataract we will kind of polish off here in a moment, and I'll describe that. So now the eye has very little viscoelastic in it, so I'm going to put more in to kind of inflate the eye. Here I check the pressure, make sure it's pressurized a little bit better. And I'm going to polish the last little bit of lens cells that are adherent to your lens capsule. I moisten the cornea a little bit more with more viscoelastic. Oh, here I'm going to open your astigmatic incisions that we made. So this is actually not a sharp instrument, it's blunt, and it just separates the opening that was created with the laser at 1 and 7 o'clock on your cornea. So those incisions were made at a 8 millimeter distance from one another. They were made at 85% of your corneal thickness as programmed by the laser, and they're a perfect circular incision, and they're exactly, I believe they're like 45 degrees in length. So we can program with the laser the exact length, depth, angle, placement, diameter of all these incisions. So it's your surgery was largely pre-programmed before we even stepped into the operating room. Placed into a little cartridge, and we can place this large implant, which is injected through a very small opening, 2.8 millimeter opening. The lens itself is 6 millimeters in diameter, but it has these little blue wings, we call them haptics, H-A-P-T-I-C-S, and they center the lens in the bag. So you don't need a 12 to 14 millimeter lens implant, you only need about a 6 millimeter width diameter lens implant, but with these little haptics, which expand out to about 14 millimeters, they center the lens in the bag, and they allow us to put a 6 millimeter lens through a 2.8 millimeter opening. The smaller the opening in the eye that we make, the faster you heal, and it allows us to do your surgery without the need for a stitch. Now I'm removing the viscoelastic from within the eye, the clear jelly that we placed, and we kind of spin the lens around to, and we don't place any stitches. The incision we made is very small. We infuse a little saline into the cornea around the incision. It causes the cornea to swell, and that swelling makes the cornea a little bit white temporarily. That disappears by the next day. We make that same effect on that side port incision, and at this point we just kind of gently center the lens, make sure it's perfect, and I'll typically tap the eye, make sure it's maintaining a good pressure. And then we're all done, and that's it. Thanks for your time and attention. No suture used. Have a great day. You did wonderfully.